Hi, I'm Mike Morgan with the Census Bureau's Center for New Media and Promotions branch. I'm here today with Matt Brault and Brett O'Hara, also from the Census Bureau, and we're going to be talking about health insurance coverage in the United States. Thanks for being here today, guys. Let's start with an overview of the information that was released yesterday. Tell us about the report and what data is now available for health insurance.
Okay, so the health insurance report is based on the current population survey. The survey is based on a joint project from Census and Bureau of Labor Statistics. And essentially the Bureau of Labor Statistics and the CPS field a supplement every month. And once a year we have a supplement that deals with health insurance and poverty and demographic groups. And it's all in here. So that's our official report on poverty health insurance. And so the main findings from our report is essentially there was no changes for health insurance. So the percentage of people without health insurance in 2010 was 16.3, didn't change statistically. And for children, it was 9.8, and again, that didn't change statistically. So, but those two rates changed are very different. So it was 6.5 percentage points. So there is a great gulf between all people and children.
Sure. What about some of the detailed findings that came out of the report?
So one finding is that over the last 10 years, private health insurance went down, and government programs for health insurance went up for the last 4 years.
And what are some of the government, for our viewers if they're not aware of the government services?
Sure, it's Medicaid, Medicare, the Children's Health Insurance Program, and military coverage. So that's the extent of what we capture.
Okay.
And also one of the key findings was that it's obvious that paying for health insurance is correlated with having a high income, and so so that bore out as true that people that had low household income were the most uninsured, and that had high household income was the least uninsured. But what was interesting was that over the last 10 years, the rate for being uninsured was concentrated in $50,000 to $75,000, that income range.
Okay, thanks. The federal government puts out several estimates about the size of the uninsured population, but why does the Census Bureau release different estimates of the health insurance coverage? Matt?
Well, there are a lot of different estimates that try to measure different aspects of health insurance. And that's all part because we have different surveys that are intended to look at different things. So the current population survey, it looks at a snapshot of the population at the national level, and it's looking at, we asked the respondents about their coverage during the previous year. Some other surveys look about only 1 month of coverage, and by doing a continuous month to month, you can look at the dynamics of health insurance and look at how many individuals are gaining health insurance over the course of the year, and then how many are losing it, and what are the reasons, and what are the various income and employment aspects and characteristics that are associated with that. We also have other surveys that are designed to get at lower level geographies, like the American Community Survey, and so it's a much larger sample, and it will capture a point in time estimate. And so as opposed to saying what was your coverage status over the previous year, people in that survey are actually asked, what is your status right now? And so it's slight differences in what exactly is being measured in that health insurance number, but it has can actually have visible effects in the actual magnitude of the uninsured rate that is put out. So, for example, last year in 2009, as shown in this report, the CPS number was 16.1%. In the ACS, the U.S. number was 15.1%. So that's 1 percentage point difference, but they're not measuring the exact same thing. Mm-hmm. So it's understandable that that a lot of data users might be confused as to what exactly is going on.
Sure.
They're both true in a sense,
Right.
but they're measuring slightly different things. And when you are looking at state estimates or county level estimates from the ACS, you want to compare them to that similar estimate.
Right, and I'm glad you brought that up. I was just going to ask you then, can you describe for the viewers and for me too, for that matter, the difference in between the ACS and the CPS, in case people don't know?
Well, they both measure the similar concepts of health insurance. They're both going to capture elements of employer-based coverage, direct purchase coverage, Medicare coverage, Medicaid coverage, military coverage, VA coverage, all the various types of coverage in which an individual may have health insurance. But whereas the CPS says, what was your coverage during the previous year, the ACS asks, what is your coverage right now? And that's one of the primary differences between the two magnitudes of the estimates you're going to see between the two surveys.
Right, okay. I'd like to also mention that if you'd like to send us a question, we'll try to answer it. You can go to facebook.com/US Census Bureau. You can also send us a question via Twitter at hashtag #poundcensus. The report indicated that the uninsured rate did not change. But the number of people without insurance increased. Can you explain this to us?
Yeah, it's primarily due to population growth. So in the population, it grows every year. And so we have the issue of being uninsured, the rate, and just by pure numbers, it growing. And so really it's the change in the net effect of being uninsured. We also have the issue of when say you're a working age adult, when you're losing your job, you might pick up other elements of coverage.
Sure.
Say government coverage. And so private health insurance went down, government coverage went up, and so it's really what the net effect is.
Okay, great. Thanks for explaining that. Does the report overall help us understand any of the reasons why people may be uninsured?
Sure. The current report doesn't. It is not asked on the current population survey. There's no indication of why they're uninsured. However, on other surveys that we collect, primarily the Survey of Income and Program Participation, they actually have a question that says, if you're insured, why are you insured? And some of the answers are like, I don't believe in insurance. And so we collect that information.
Right, and some of the other reasons may be somebody's healthy and
Right.
don't feel like they require insurance or something. So there's a
Exactly.
variety of reasons. Okay, thank you. Again, if you want to send us a question, we're at facebook.com/US Census Bureau and via Twitter at hashtag #poundcensus. If someone wanted to, let me back up. The release was a national release, right? If someone wanted to compare, say, how their state ranked or compared to the national stuff, how would they go about that?
Well, we do put out state estimates from the current population survey. However, when you look at the sample size that was used for this, which was about 100,000 households, breaking it down to individual states, sometimes the variances can get quite large. And then when you're trying to make statements about comparison, and we're going to say that a number is statistically different in one state from, let's say, another state or from the national level, the variances can get high, and basically it might look like there's a difference, but statistically, you really can't parse that out, and it's difficult to say what is an actual statistical change or difference between the two estimates. We also put out state estimates in the American Community Survey, which has a larger sample size. So because of the larger sample size, the variances are going to be smaller, and you can get a better idea of some of the of what is different. So with the CPS, for a lot of the larger states, California, Texas, New York, some of the variances may be reasonable and you can make some comparisons. But when you start getting to some of the smaller states, it becomes more difficult. So we actually suggest that most data users will use the ACS for making state level estimates and making comparisons that way.
Okay, great, thank you. Does the Census Bureau for this report, does the agency collect information on, say, non-citizens? I mean, what is the range of the data collection effort that goes on for this report?
Data are collected for all individuals. It's a household-based sample. So we all we start off with is with an address. And it doesn't matter who's living in that address. We attempt to collect the information from them. We do ask some questions to denote whether or not someone is foreign-born or whether they were native-born, and then whether or not someone was a citizen or non-citizen. So we actually can look at some of the statistics for health insurance coverage for the native-born population, the naturalized citizens, so people who are foreign-born who have become citizens of the United States, and then non-citizens. Now, we don't differentiate in the non-citizen population between those who are legal status, whether documented or undocumented.
Right.
But what we do know is that non-citizens had an uninsured rate of about 45.1%, and that number did not change from the previous year, no statistical change. In fact, naturalized citizens were the only group between the three of native, naturalized, and non-citizens who actually experienced a change, and their uninsured rate increased by about 1.6% between 2009 and 2010. Native-born citizens had the lowest uninsured rate, and that was at 13.8%.
Okay. Do we see an impact in the results from any recent federal legislation on health insurance, or is it too soon to tell?
So most of the legislation pertains to 2014. However, one part of the legislation was effective in last year, and so that involved being covered by either the family's plan. And so we did see a decrease in the uninsured rate between for ages 19 to 25, and that's the age range that we expected to be affected. And so I have it here. The uninsured rate dropped 1.6 percentage points between 2009 and 2010.
Okay, thanks. If people are looking for more information, some reviewers or anyone else, where would they go to find that? Where can they get more information?
Well, you can go to the Census Bureau's website at census.gov, and on the main page there's a link to a health insurance page, which you can find both the report and a number of detailed tables, historical series, as well as information at the state level, and also health insurance information from other Census Bureau data sources.
Okay. Is there anything else you guys would like to add or talk about?
So one thing is if someone looks at last year's report and sees a different number for 2009 between the reports, there was a change in method for calculating health insurance.
So you're talking about between 2009 and the recent data from yesterday?
2009 last year and 2009 this year are different. And
Okay.
so we have a paper explaining the difference.
Okay.
If you go to our website, there is a paper explaining the difference. And essentially that was because of research done 4 years ago. And so we've been trying to incorporate the research.
Sure, just make it as accurate as possible.
Exactly.
Yes. Sure. Okay. I think that's all the time we've got. Thank you guys for joining us, and thank you for tuning in. See you next time.
Thanks.
Hi, my name is Susan Combs and I'm an insurance broker for Combs & Company. The risk with no insurance coverage. The main thing to think about when going with no insurance is it always seems that Murphy's Law comes into play. So if something bad's going to happen to you, it's always going to happen when you don't have any insurance in place. I've seen it happen time and time again. But the things that you have to think of is, with insurance, it protects you against the worst case scenario type of thing. So in the business, we talk about self-insurance. So that means basically the limit that you're willing to pay or that you are comfortably laying out if something were to happen. So for example, on this, when it comes to, say, a second home, you might own a second home and the value of the home is, say, $100,000. And in the bank account, you have $500,000. So you might say, okay, comfortably, I'm okay with just having liability and not insuring any of the property inside the home because I know financially I'm in a position that I can pay to replace everything inside the home if something were to happen. So that's where we talk about going with no insurance or self-insuring because financially you're in a position that that's okay. But then on the flip side, if say that second home you owned was a $500,000 home and you have $100,000 in the bank, you might not want to consider going without insurance because financially it would really ruin you if something were to happen to that location. So the best thing to do is to consult with an insurance professional that's really going to kind of walk you through the worst case scenario of everything and give you the ins and outs and the do's and the don'ts of going without insurance.